talk about mental health. October 10th is World Mental Health Day, and while some still shockingly consider it a taboo subject, it is such an important and sensitive matter. Let's talk about some shocking facts. Did you know that depression is one of the leading causes of mental health disabilities, affecting over 250 million people? People with severe mental disorders can die 10 to 20 years earlier than the general population. And did you know that the rates of mental health workers vary from below 2 per 100,000 in low-income countries to over 70 per 100,000 in high-income countries? That means that there are 2 healthcare professionals that specialize in mental health for every 100,000 in low-income communities. The global economy loses about $1 trillion per year in productivity due to depression and anxiety. There is absolutely nothing wrong with going to see a professional. Let's talk about the different types of professionals. How are therapists and psychiatrists alike? Well, they both want to help you. And how are they different? A therapist is a mental health care practitioner who has the goal of helping you recognize and navigate the issues that may be holding you back in life. They usually use talk therapy and can use a whole other form and sets of therapy. While a psychiatrist, on the other hand, is a medically trained doctor. They can diagnose people and they offer individual treatment plans, which may or may not include medication. Typically, people go to a therapist perhaps once a week, whereas a psychiatrist they may only see from time to time. When should you seek mental health help? So these are some factors, but they're not an exclusive list. If you're feeling sad, angry, or not yourself, if you're abusing substances, if you've lost someone or something important to you, such as a death in the family or a job loss, if you've experienced a traumatic event, such as an accident or domestic abuse, or if you don't want to do things that you used to enjoy. These are very general, but basically you can always get help. You can look at childhood trauma, explore your past, and work on issues you may have. How affordable is getting mental health help? A lot more than you may think. Call your insurance provider and ask for the clinics that are covered. A typical session can cost anything from 400 to 800 dirhams. However, you may only need to pay a small percentage as a co-payment, as little as 80 dirhams at a time. See your options and weigh them. Even if you need to pay out of pocket, the treatment may help you immensely and be worth it. Let's talk about some real stories of people who have endured mental health problems and were brave and wise enough to get some help. The first example is a woman who had a child and realized that motherhood was very different from how she expected. She felt empty and did not feel a bond to her baby. She felt terribly guilty about this. When she sought help, it turned out that she was suffering from postpartum depression. She got help and overcame it. Did you know that 10 to 15% of women suffer from postpartum? And many don't seek help at all. It is important that people in these types of situations know that they're going through something that other people are going through and that they can get the help they need. Let's look at another example. Michael Phelps, a swimmer and one of the most iconic Olympians of all times, suffers from ADHD and intermittent depression. We often think of great athletes as invincible. However, even the best athletes, like all people, can suffer from mental illness. When Michael opened up about his struggles, many other athletes came forward, and the topic became a rampant subject discussed even in Sports Illustrated and other media outlets. Now let's look at mental health during the pandemic. People are social beings. We need other people. Hence, this pandemic has been hard for all of us. There is absolutely no shame in trying to cope with the hardships that this pandemic has brought. The UAE has set up hotlines and mental health volunteers to assist with calls. Many are coping with job loss, being overwhelmed, teaching their kids at home while working, and not being able to go out. It is all right to feel a sense of loss for the life we used to know and to equally grieve for that loss. This pandemic has brought people together, on the other hand, more than ever before, and technology has been our connector. It shows that people can truly surprise you and amaze you when put in an unprecedented situation. I sincerely hope that this podcast has shed some light on mental health. I hope many of you are willing to seek help when you need it and to experience the lasting effects and benefits. This is Fatma Gbesi. Stay tuned for more episodes on GLP channel, and we hope to see you soon.